My name is Heather Daniel. I'm in the nurse practitioner program at Auburn University. Today I'll be doing a head, eyes, ears, nose, throat, cardiovascular and abdominal assessment. Before we started our assessment, I performed hand hygiene. We also took Pete's vital signs, and they are within normal limits. To start the survey, I would assess how the patient walks in the room to assess his gait, noticing if he was favoring one side, had any limping, make sure he wasn't in any physical distress at the time of the assessment started. Throughout the assessment, I will listen to his voice and articulation, which will be cranial nerve 5, 7, 10, and 12. I will also be making note of his mood. I would make note of what type of clothing he has on. Is it clean? Is it appropriate for the season? Does he look like he takes care of himself, or does he look like he has neglect, like he's dirty, anything like that? I would also note right off the bat, any skin that's exposed. I would make notes of any lesions, bumps, skin conditions, dryness, anything like that. We'll look at his fingernails. Are they clean? Does it look like he's well maintained and healthy? I would then start from the head and work my way down. I'm first going to just inspect the head. I would note any deviations from side to side, any bumps, lumps, any sunken areas. I would look at the distribution of his hair. Is it even throughout? Is he missing patches? Does it look overly greasy? Does it look overly dry? From then, I would palpate the scalp, noting any tenderness. Are you tender at all? Just let me know, okay? Tender?
No.
Oh. I would also feel if his hair, is it brittle? Is it greasy? Is it dry? Anything like that. And it's not. Is it easily flakiness? Is there any flakiness or anything like that? I would also have my patient smile, frown, puff your cheeks, raise your eyebrows. Okay, and that is testing for cranial nerve 7. From then, I would palpate the sinuses, subfrontal.
No.
Maxillary. Can you clench your teeth for me? Clench and show me your teeth. We're then feeling, this is cranial nerve 5, testing, feeling for the master and the temporal muscle are intact, and they are. Also have the patient open and close their mouth, and we're looking for TMJ, looking for any crevice. Open and close. And he does not have any, and that's a normal finding. We'll then also palpate the lymph nodes of the head and neck. So pre-auricle, post-auricle, occipital, tonsillary, submandibular, submantle, parotid, skip one, precervical, anterior cervical, and supraclavicular. And I didn't note any lumps, any fixed nodes or any fixed areas at all. It was all soft, nothing hard. I would then move on to look at his eyebrows. I would note if there was any swelling, flakiness, redness, making sure they were evenly distributed on each side. I would then move on and look at his eyelids, eyelashes, and eye area, making a note of any drainage, tearing, redness, swelling, anything that may look like infection on each eye. I would then palpate. I would pull down his lower lid to make sure his conjunctiva is pink and moist and not red. Moving up, looking at the cornea, pupil, iris, and sclera. Sclera is white. There's no cloudiness to the cornea. I would also palpate the lacrimal duct and the orbital area.
No.
And that all looks good. Moving on to eye assessments. We would do this chart is the handheld chart, and it's normally Needs to be held 6 feet away, but for the purposes of this video, it's not going to be. I would have the patient read the line that he sees best, and based off that, it would give us his visual acuity, which is cranial nerve 2. So cover your right eye. Tell me which line you see best.
LTFPH.
Okay. Left.
LTFPH.
Okay, now both.
LTFPH.
Okay, and he has 20/20 vision. Moving on to other tests, we will do the confrontation test, and that is checking his visual, his peripheral vision, which is cranial nerve 2. I'll have the patient cover one eye, and I'll cover my opposite eye, and we'll see, wave my fingers in front of his face and see if he sees it. Just tell me when you see my finger. Oh, cover your eye. Okay.
No.
Okay.
No.
Okay. All right. Okay, that was normal. I would then test cranial nerve 3, which is the cover test, which is cranial nerve 6. Cover one eye for me, and then swap. Okay, there's no deviations there. And we're going to test his light and accommodation as pupils equally round and reacting to light, and that is an accommodation, and that is cranial nerve 2 and 3. Okay, so I'm going to turn my pen light on. Look forward for me. And what we're testing here is to see if both eyes constrict even though one eye is getting light shown into it. Okay? And they do. And then I'm going to have you look forward. And this is making sure it accommodates. Look at my pen. Follow my pen without moving your head, okay? And his eyes do cross, which is a normal finding. I'm also going to check his point of vision, and I'm going to assess 6 different sites. This is cranial nerve 6. Okay. Keep your head still and follow my pen light, okay? And this is just making sure there's no astigmatism, which is shakiness in the eye when it moves from one point to the next. And that's a normal finding. He did not have any shakiness in astigmatism. We are then going to do his scope test. What we're going to do first is we turn on the light, and so I'll use my left hand and left eye to do, right hand and right eye to do his right eye, and vice versa on each eye. So we turn on the scope, put it at 0. Look straight for me. We would also dim the lights, but for the purposes of this video, we will not. So what we'll do is we'll look at his red bright light reflex. Once we find that in his eye, we follow that, and it will bring us to the optic disc. And from there, we'll look at the vessels, the macula, the centrioles, and make sure there's no hemorrhages or anything like that. So once you find the light, you get closer. You might have to adjust your as you get closer. Okay. So again, left hand, left eye. That's the first step. I didn't note any hemorrhaging or anything like that, so he's good to go there. I will then move on to his hearing. What we would first do is look at his auricle. We would note any lesions, flakiness, if it was swollen or anything like that, any edema. Cleanliness, any lesions. Sun likes to get on your ear, so always check for that. We would do this bilaterally. We were then going to do the whisper test, which is cranial nerve 8, as well as Weber and Renee. They all three deal with cranial nerve 8. So first, the whisper test. I'm going to stand a few feet away and whisper 3 words and see if Heath can hear me in both ears.
1, 2, 3. 4, 5, 6.
Okay, so that is correct. This is the Renee test. I'll strike the fork and place it, the tuning fork, and place it in the middle of his forehead, and I'll have the patient tell me when he stops hearing the noise in either left, right, or both. Ready?
Both.
Okay, and that's a normal finding. If there was no deviations to one side or the next. This is the Weber test, so we'll strike the fork, place it on the back of his bone right here. He'll tell me when he stops hearing it, and then we'll move it to air, and he'll tell me the same as when he stops hearing it there as well.
Now.
Okay, and bone should last longer than air, so that's correct, a normal finding. And I'm then going to palpate the auricle, making sure that it is movable, there's no pain. Is there any tenderness?
No.
Okay, making sure it's movable, it's not hard, I don't feel any bumps, lumps, or anything like that. We'll do that on the same. Tenderness?
No.
Then I'm going to move on to looking into the ear. What we're going to do is we're going to look at the ear canal, making sure it's patent, there's no foreign bodies or sores in there. We're going to look at the tympanic membrane, making sure that there's no cloudiness that could mean infection or redness that could mean infection. It should be just pearly and clear. And what we'll do is you turn on your light, and with an adult, you're going to pull the pinnate up and out. Okay. I don't know any foreign bodies, lesions, the ear canal. See the cone of light, and the tympanic membrane is not red or cloudy. Do the same for the other ear. Again, making sure you see the ear canal is patent. There's no foreign bodies, no sores. Looking for that. There it is. No redness or anything like that. Perfect. We are then going to move on to the nose. Oh, got to do his corneal light reflex. That is one of the cranial nerves. What it is if light is shown in one eye, it should also show in the other eye, even though the light is not shown. Kind of like the restriction, but you should just see the light in both eyes. Look forward for me. Sorry. Okay, yeah. Okay, perfect. So, and it did. They were equal on each side, despite which eye was getting the actual light shown into it. We're then going to move on and look at his nose. We're going to note any lesions, making sure it's not deviated to one side or the next. Redness, we would know any drainage. Is your nose stuffy at all?
No.
Okay. We're going to have to test his cranial nerve 1. And this is his olfactory nerve. What do you smell?
Peppermint.
Okay, perfect. And we should also test for patency. So I'm just going to have you sniff. Okay. Awesome. Clear. we're gonna look up the nose. We are gonna look for make sure that the septum's not deviated to one side or the next. Gonna look at the mucosa, making sure it's pink, moist, turbinates, no foreign bodies, no lesions, no anything like that. Okay. All right, looks good. Then gonna move on to look at his lips. We would note any dryness, lesions, any white in the corner of his mouth. Gotta look past that mustache, but making sure the color is uniform, it's pink, no blue or purple or anything like cyanosis or anything like that. We're gonna then look inside of his mouth. So we're going to look at his palate, his teeth, his gingiva, his bronchial mucosa. Lift your tongue up for me. Put your tongue down. Go ah. No, put your tongue in your mouth. I'm just trying to look at your tonsils. Okay, they're back there in the uvula. We'll have the patient open his mouth and say ah. And that is testing for cranial nerve 9, making sure the uvula is intact. And we would also have a popsicle stick and test the patient's gag reflex, which would be cranial nerve 10. And everything looks pink, moist. You would make note of any sores. If there was sores, you would palpate and things like that. But it looks good. Cavities, any missing teeth, anything that looks like redness or irritation, we would make note of any of that. We're then going to move on to looking at his neck. Just have him look up. I don't see any thrills, anything like that. I don't know any lesions, bumps, anything like that. We're going to palpate to make sure the trachea is midline. And it is. I'm going to go behind you and we're going to check for his thyroid gland. We're going to come behind, put the pads of our fingers here, and we're going to have the patient swallow. Okay, swallow again for me to make sure. Okay, that's good. Also, while we're back here, I'm going to put resistance down on the patient and have him shrug his shoulders. And he was able to move his shoulders just fine, as well as placing my hand and having him pull against my hand. So the patient is able to move his shoulders and head side to side, which is against resistance, which is cranial nerve 11. Can you stick your tongue out? Move it up and down, side to side. Okay, perfect. And that is cranial nerve 12. So from there, we're going to move on down to cardio, and we're going to look at his shirt would be off, and we would look at color. We would be looking for any thrills, palpation throughout, making sure nothing funky was going on there. Also, with visual inspection of the cardiovascular system, you would look at, can you put your feet up for me? You would look at his extremities. You would look at all 4. Is there any swelling? Is there any blueness? Is there any overly redness? Dry skin, flaky skin? Mainly edema is a big thing to look for on either. Is the color uniform throughout his body? Or his feet the same color as his hands? Things like that. We would then move on to feeling. And we'll start by feeling his pulses. We're going to start with the temporal. Okay. And the carotid. So do this one side at a time. Awesome. With these 2 pulses, you're also going to listen. You're going to auscultate with the bell. Listen for any bruise. Oh, I'm sorry. Breathe in and out. Hold for me. Breathe in and hold. let it out. Breathe in and hold. Okay, I didn't hear anything that was abnormal. Then gonna move on to the brachial pulses. You would grade these on their how strong they are, their integrity. These are +2. So they're easily palpable, but they're not just booming, booming, booming. And it's not thready. It's a good pulse. Radial. Move on down to popliteal. You can also do femoral, but for the sake of this video, we will not. Femoral. Popliteal. I'm sorry. Push your feet out. Awesome. Pedals, which is on the, if you can't see me, it's on the top of the foot. And then tibialis is on the side, kind of near the ankle. And all those pulses were good, +2, strong, good pulses. Then while you're assessing the pulses, you also need to feel that skin. Is it cold? Is it clammy? Is it hot to touch? Could there be something underlying there? As well as with feet, you're going to be feeling, is it cold? Is it clammy? Any tenderness in your legs?
No.
Also, feeling for swelling. I don't know any swelling. Sometimes you might not. It may not look like it's swollen, but when you get to feeling, you can see that it's pitting a little bit, and his do not. We're also going to look at capillary refills in each extremity, and they should be brisk less than 3 seconds. So the blood should fill back as soon as you let go of that finger or toe, and his do. So that's perfect. We're then going to listen to the lung sounds. Heart sounds. We're going to listen all 5 points, as well as we'll locate the apical pulse and listen to it and feel a bit. We've already looked it over. We would look it over for any thrills, palpitations. We would feel for any noticeable pulsations, any lumps or bumps everywhere. Check them everywhere. Anything like that. Are you hungry? Okay. Then going to listen to all 5 areas. Second intercostal space to the right. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Flip it over and listen to the bell. We'll do the same. Aortic, pulmonic, Erb's point, tricuspid, and mitral. To locate, before we lay down, to locate the apical pulse, you'll go mid-clavicular line, 5th intercostal space. So, which we can't see because we're trying to keep modesty. We feel it. Then we would listen for a full minute. For the purposes of this video, we will not. Okay, awesome. Gonna have you lay down for me. So we obviously don't have a 45-degree angle, but to check for jugular vein distension, we would have the patient lay at a 45-degree angle and have the patient turn their head, and we would look for any bulging. We would hold it, and it should come about and then flatten back out as soon as we let go of each side. And it does. Let me sit up just a little bit. We're then gonna again listen to those heart sounds in the recumbent side. aortic, pulmonic, herbs, tricuspid, mitral. Okay. We're then gonna move on, and if you just lift your shirt up for me, we're gonna move on to the abdomen assessment. Sorry. And we're gonna look at the curvature of his stomach, the movement of his stomach. Do we notice any paralysis where food's being digested? Any thrills or anything like that? We would look at the umbilicus. Umbilicus is at midline. Any lesions, again, always look for anything like that. We would look at the skin. And on abdominal, before you touch anything, you're going to listen. So we're going to listen in all four quadrants. And all the vowel sounds are present. Next thing we're going to do is we're going to palpate. We're going to first do a light palpation, and that's looking for any hardened areas, any lumps, bumps, like we've been looking throughout. We can also feel of his inguinal areas, the horizontal and the vertical, what's the word I'm looking for? Nodes, making sure they're not hard or inflamed or anything like that. So this is light palpation, and you let me know if there's any tenderness, because that's another thing you're looking for light palpation. You okay?
Yeah.
And go ahead and feel for horizontal nodes. What I'm gonna do is, this is marvelously as possible. Horizontal goes across and vertical goes down. They're then gonna do deep palpation, which will we'll try to look for the organs. We'll do liver and spleen, and to measure the liver, you come down mid-clavicular line, and when you first feel it, you make a mark, and then you continue on. And I don't have a tape measure, but you would continue until you stop feeling it, and you can make another mark. Like, make a mark, put a little post-it notes or something, so you're able to measure it, and it should be 7 to 8 centimeters long. If it's larger, obviously there's some inflammation going on. Just gonna feel. This is deep palpation, trying to feel those organs. Also, in the middle, you should be able to feel the aorta. Okay. You can also go around back and try to feel the kidneys on each side. We'll flip over to the back when we do the CBA tenderness in a minute. But that's deep palpation. You have to go kind of deep. And sometimes depending on the patient's size, you might not be able to feel those organs. We're then going to go on to percuss. Bone right there. I'm going to have our patient stand back up. Turn around for me. So again, trying to keep somewhat some modesty. To find the CBA point, which would be, it would locate your right and left kidney, you would come down, you would follow your spine and come down 12 intercostal spaces. You would then place your hand on the patient and hit it with your fist. If there is tenderness, you would check both sides. If there is tenderness, there could be an infection. And you let me know if this hurts, okay?
No.
Again, 12 spaces down.
No.
Okay. Now turn around. We make sure we didn't miss anything. I think that's it. Thank y'all.